Hemodialysis. Introduction. Please point to the kidney. Choose one of the following options. Correct. Each kidney is shaped like a bean. The human body has 2 kidneys. The kidneys filter harmful substances out of the blood. Select true or false. Correct. Harmful substances called toxins are sent out of the body through urine. During hemodialysis, a special filter removes the waste and extra fluids from the blood. Select true or false. Correct. Hemodialysis does the work of the kidneys by removing waste from blood. Which of the following is not a job of the dialysis machine? Choose one of the following options. 1. Clean waste from the blood. 2. Make sure the dialyzer is disinfected. 3. Pump blood and watch the flow for safety. 4. Watch your blood pressure and the rate of fluid removal from your body. Correct. Staff at the dialysis center should make sure the dialyzer is disinfected and marked with your name if it is going to be reused. It should also be tested to make sure it is working correctly. Once the hemodialysis is started, your treatment will not be adjusted. Select true or false. Correct. The dialysis solution may be adjusted based on the results of your blood tests and how well you handle treatment. Which of the following is a common condition related to kidney failure that is commonly seen in hemodialysis patients? Choose one of the following options. 1. Extreme tiredness. 2. Joint and bone problems. 3. Itching. 4. All of the above. Correct. These conditions are all related to kidney failure and are common in hemodialysis patients. Consuming too much protein can be harmful to the heart during hemodialysis. Select true or false. Correct. High-quality protein should be added to the diet of a dialysis patient. Eating too much potassium and salt, as well as drinking too much fluid, can be harmful to the heart. Thank you for using Explain.